targeting drug that's called tamoxifen. It's a chemoreceptor. Tamoxifen, interesting name, because it is a SERM, select estrogen receptor modulator. So I look at the drug name, MO modulator, and T, I use it to remember that it's for tits, so breast. Also maybe top, because it's on top, as an antagonist, which is important, estrogen antagonist, because it also acts as an agonist, not on the top part, on the lower part, where it's an antagonist to the bone and the endometrial, which is not something we want in this treatment, because we do want the antagonist of the breast part for treatment, even the bone part, because it does prevent osteoporosis, especially for postmenopausal women. But the endometrial part, for uterine, that is unwanted. So I use the U as unwanted as one of my mnemonic, uterine, for the not ideal side effects of tamoxifen. Other breast cancer could be progesterone receptor positive and even HER2 positive. There's a drug that's trastuzumab. If you say it fast enough, people won't catch you, right? Really bad at spelling drug names, but one of the famous mnemonic is trust her. So trust her as HER2 receptor modulator. And if you know the pharmacologic man, that's vincristine, vinblastine for peripheral neuropathy on the outside. And on the heart part, remember how there's like a D and there's like a T as like the septum of the heart, right? Looks like this specifically. The T part is trastuzumab, because it gives you a adverse effect of cardiomyopathy. And the D part is doxorubicin, which is a cancer drug. I think Board and Beyond mentioned that trastuzumab is somewhat reversible, so not as detrimental to doxorubicin, which is irreversible. So you can have patients stop this drug for a while and let them recover on the cardiomyocytes, but it really depends on patients' individual condition in real practice, and you can re-challenge them. So that's most of a pharmacologic treatment. It also depends on the tumor marker for treatment. There's also aromatase inhibitor, which it ends with ozol. So my first time looking at it, I almost thought it's like an azole antifungal drug, but it's not. Anastrozole is one of the commonly used one. There's also the one that's ANE, that's exmestane. And these drugs are only used for postmenopausal patients, I guess, because estrogen is too strong in premenopausal women. They just have too much, and it's really hard to like block the effect of estrogen with only an aromatase inhibitor. But postmenopausal women, they get their estrogen from peripheral fat tissue convert to estrogen, right? So it just works better. There are other stuff, lifestyle modification. They can be